All right. Well, I think we have all our key players here, so we will get started. Welcome everyone to the August E&T All-Staff Virtual Meeting. This meeting is going to be a bit different than our normal staff meetings. We're going to focus really on the campus reopening and what our business will look like. So today's agenda, we will have opening remarks from our interim executive director, Lisa Kerbling. Gio will give us an update on all the office construction that's going on. Abdallah will give us an update on everything happening around campus and what to expect. Tyler will give us an IT security update, and then Veronica will come in with our health and safety update. And then at the end, we will do a Q&A session. So some of you have already submitted questions via the online form that we emailed out in the news bulletin. But for those of you who still have questions, you can submit them using the Q&A function within this Zoom webinar. So don't send them through the chat, send them through the Q&A so we can look at those and answer them at the end, time permitting. And then if you see a question that you wanted to ask that somebody already asked, you can click the thumbs up icon to upvote it and kind of get it more toward the top of our list. So you can also ask the questions with your name or anonymously. For those who may be new, these are the links that you might want to bookmark for news regarding employee stuff within E&T, our operational updates, and just general campus COVID updates. And with that, I'm going to hand it over to Lisa.
Thank you, Lauren. Good morning, everyone. As Lauren mentioned, we're going to spend the next hour discussing the operational ramp up for fall and how UCLA is working to ensure that this move forward to more in-person activities as safe as possible for our staff, students, and visitors. I do realize that some of you are eager to return to campus, while others are maybe a little more hesitant. So I do want to thank everyone for moving forward to our new hybrid work model. I think it's the right move and the right next step for us, but realizing that some people are a little hesitant, we are leaving a little more time than usual for questions. So please allow us this opportunity to address any concerns you have. And with that, I'm turning it over to Gio Barrientos.
Thank you, Lisa. Good morning, everyone. I'm Gio Barrientos from Parking Assets and Facility Management. I will be sharing with you security, safety, and office construction updates. Let me start by sharing key security changes. So beginning on September 7th, the alarm will be deactivated as the department has gone away from cash handling. We're also in the process of adding extra perimeter access points into our department. The image on the left is of the door outside of the CRN space that goes to the August Strathmore restroom. The image on the right shows the door that goes from the inventory room to the hallway breezeway. Next up are some safety upgrades. The HVAC filter are being upgraded to MERV 13. The MERV 13 filters help capture microscopic particles from the air better than the previous filters. Air purifiers are being added throughout our department and across campus by facilities. We have added a clear barrier on the CRM open counter as a safety precaution as well. Another upgrade in our department is the integration of sensor products in our restrooms, such as the paper towel dispensers, sink faucets, toilets. These sensors reduce or limit touching of high-use items in the restrooms. Some miscellaneous changes is that trash pickup is no longer available for individual workstations. Staff is expected to sort out and put their trash in the centralized receptacles across the department, which is shown at that lower picture with the 3 options. The food cabinet is now located in the main break room. Please continue to donate food for our student workers. Throughout the all-staff meetings, we have mentioned different office renovation construction. This slide shows all the office renovations that have been completed and their new locations. And I'm also going to go through each of them. The CRA office was relocated from 106 to 100. There was an opportunity to repurpose the lobby space with a reduction of foot traffic due to e-permits and other technology integrations. The events office was relocated from Kirchhoff to Suite 106. The events team no longer needs to traverse through campus for meetings as they are now closer to the rest of transportation. The move also allowed the events office to terminate their lease. My unit, PFM, which includes the operation team, has relocated as well. We were able to repurpose that space that was formerly occupied by field ops. The OT or the operation team are also no longer upstairs, but rather are there with the rest of the team. The enforcement team are now our neighbors as they are next to us. This space provides the team extra space for the briefing and extra workstations. The construction of the hoteling space in room 126 is complete. The space contains about 17 workspaces. At the moment, usage of the hoteling space is on a first come, first served basis with no particular seating arrangement. However, the department is working on a sign-up system for the future. The space includes both wireless and network cables for connectivity. There's also high adjustable tables that allow our staff members to either stand or sit while using the hoteling space. We're also in the process of obtaining lockers for staff to use for personal items while using the space as well. The ITG Help Desk has also relocated. The new location provides more space and brings the team closer to the business units. The ITG Help Desk will have a service window that will be used to provide support. We're still not done. The following projects are in progress. We have the customer relation management unit space is being upgraded to accommodate the growing team, which will also include the data analytics and strategic project unit. The space may be potentially ready by winter. Fleet and Transit is also in the process of renovating their space, which may be ready by fall. I know there's a lot of questions. Where are they now? As a department, we're adding a layout on the website that illustrates the moves. However, also Lance and Vanessa put the following video together to showcase the office construction. Thank you, Lance and Vanessa, for that great video. I will now turn it to Abdallah, who will share campus updates. And thank you again.
Thanks, Gio, and yes, great video IMC. Hey everyone, I'm Abdallah from MPTS, and I'll be going over some recent updates on campus to be aware of. So lots of activity happening at Lot 36 for anyone who's been on campus recently has likely seen. Namely, Geffen Academy has been using portable classrooms due to enrollment growth, and even more impactful is the end wall piling taking place for the future Westwood Purple Line station. As expected, these activities contribute to reducing the number of parking spots we have for use on campus. And on this slide, you'll see a recent photo taken of the aforementioned work taking place at Lot 36. Excuse me. Speaking of more Purple Line extension work, subway station construction will be underway in just a few short weeks that will consist of digging an 800-foot hole under Wilshire Boulevard, which will lead to lane reductions on Wilshire between Better End and Westwood for about 6 months, starting in mid-September. Also worth noting is that Metro is swapping out colors for letters when naming their rail lines. So the Purple Line will eventually be known as the D Line. On this photo, you'll see a picture of what the work on Wilshire will look like, along with the accompanying lane closures. On the complete opposite side of campus, the effort to convert parking lot 15 into an undergraduate dorm building was recently completed and will be ready for fall move-in, adding 1,800 new beds on campus. This will help in decreasing the proportion of commuting students, which is expected to in turn reduce traffic and demand for parking, as well as, of course, giving more students a chance to benefit from on-campus residential experience. On the topic of additional res halls, another dorm for undergrads is currently under construction on the corner of LeConte and Gailey, with an expected completion by January, adding another 1,200 beds for on-campus living. Again, this would allow students to take advantage of the benefits of living around campus in Westwood and will further reduce the need for students to rely on commuting in order to access campus. Now on to ASU-CLA expanding their hours in time for the campus ramping up in the fall. As you can see on the screen, Ackerman and Kirchhoff will now be open longer with their specific operating hours on the screen, and Kirchhoff Coffee House will finally reopen on September 7th. Be sure to visit the webpage on this slide, UCLA's COVID-19 site on the Return to Campus webpage, for more specifics on the expanded operating hours of campus buildings and stores, as well as what will remain closed or with limited operating hours. Regarding UCLA recreation operations, REC members will need to make an advanced booking, sometimes as long as 72 hours in advance, in order to access the REC facilities, some of which are listed on this slide. Keep in mind that IM Field is still closed until further notice due to damage from the water main flood. And of course, keep an eye on UCLA REC's webpage for information on any important updates regarding facility access. And that concludes my updates from campus, and now on to Tyler with some IT updates.
Thanks, Abdallah, for those updates. It's great to see that the UCLA is under construction like always. So my name is Tyler Foshi, and I'm with the Information Technology Systems Group. And I'd like to give you a few updates about what my team has been working on lately. So the last time we spoke, we talked a little bit about the FireEye endpoint security rollout. So just a quick reminder, FireEye is a great security solution that campus IT is implementing for all of the computer users across campus, and the E&T IT group is partnering with them. And FireEye offers enhanced threat prevention, detection, and incident response. So it does a lot of things. And one thing it does is virus scanning. It's not doing the virus scanning right now, though. So what we did was my team rolled out FireEye to business user computers and production servers in July. And we've been really monitoring it since then. And so far, everything looks fine. For the next step, we're going to be working with campus IT to really enable what's called active mode for FireEye, meaning it's going to take over virus scanning on your computer from whatever product that you're using right now. But that will come a little bit later. Next up is the email security update. So you've probably heard quite a bit about this project from David Shaw, our Chief Information Security Officer, and myself. So campus IT, again, here is taking the lead on launching multi-factor authentication for not just email, but a lot of other Microsoft products and services too. So why are we doing this? The reason is MFA gives enhanced security when you're logging into your email and other Microsoft services. And my team is helping out with that effort as well. So what is MFA? So without MFA, you normally log into your email with a username and password. Well, if a third party got that information, they could log into your email as you and use it for any reason. So with MFA, you'll still log in with the username and password, but then you'll also be asked to confirm your identity with a phone call, a passcode, or a duo push. And this is the same way you log into other systems today, like MyTime or Kronos. So there, even if a third party were somehow able to get your username and password, they still wouldn't be able to log into your email. So it makes it very secure. For the scope of the project, it includes just about every Microsoft product in the cloud and that's running on your device. So this includes Outlook for Windows and web, mobile mail apps, Office for desktop, Office 365 for web, SharePoint, OneDrive, and Microsoft Teams. So you can see the scope of the project is really big. The status is the original plan was to convert everybody in events and transportation over on August 20th, last Friday. We have a new plan now. So under the new plan, we're converting groups of users every day, starting last Friday and finishing by August 31st. So you may have already been contacted by me or someone in my team, and we're going to be working with everyone closely. If you haven't been contacted, you will be soon. And when we do reach out to you, please respond quickly because we have a very short window to get this important update done. So we definitely appreciate your support and thank you for your help on this project. So those are all of the updates from the IT group. At this point, I'd like to turn it over to Veronica, who will tell us some news about health and safety for the department.
Thanks, Tyler. Hi, everyone. Hope that you're doing well. I'm Veronica Martinez from Central Administration, and I'll be providing the health and safety updates for E&T. UCLA is requiring all faculty, staff, academic appointees, students, and everyone accessing UC facilities or in-person UC programs to be fully vaccinated against COVID-19 with limited medical and religious exemptions prior to the beginning of the fall term 2021. Exemptions may be requested through Insurance and Risk Management's How to Request a COVID-19 Vaccine Exception page for details and guidance before initiating the process. UCLA faculty and staff can schedule a vaccination through UCLA Occupational Health Services by calling 310-825-6771. UCLA health patients can schedule their free COVID-19 vaccine appointment through the My UCLA Health site. You may also book an appointment through California's My Turn page or through vaccination providers if available. Sorry about that. Staff can confirm their vaccination through the UCLA COVID-19 symptom monitoring system site through one of several ways. One, you can give UCLA consent to check UCLA health records and the California vaccination database to verify their vaccination. Two, you can upload an official medical record from their medical healthcare provider to upload an image of their CDC vaccination card or a non-US equivalent. Student employees may submit proof of their vaccination by logging into Arthur Ashe Student Health and Wellness Center's electronic patient portal and clicking on the medical clearance section. UCLA Health's COVID-19 Vaccine Information Hub provides the most up-to-date details about the vaccines and answers to dozens of common questions about vaccine safety, effectiveness, and availability. COVID-19 daily symptom monitoring is an important part of safely returning to work. The survey must be completed prior to starting your work shift. If you have not done so, please register at the site on your screen. The site can be easily accessed after registering, bookmarking, or saving the site as a favorite on your web browser. You are only required to complete the survey on the days that you will be reporting to work on site. If you are clear to report to work, take a screenshot of the certificate on your smartphone. If you are not cleared based on your responses, follow the instructions provided and notify your supervisor. Currently, COVID-19 testing is required once per week, regardless of your vaccination status. Self-administered saliva-based testing kits, such as the one shown, and drop-off collection bins can be found at more than a dozen COVID-19 test vending machines and distribution centers located throughout campus. The interactive map on the site is available to show where the nearest location to you may be. Anyone with an active Bruin card may retrieve up to 2 of these tests per week for free. FAQs can be found on the site on your screen. Here's a tip from those that have been completing this test. Take 2 tests from the vending machine so you can have a completed test to drop off when you pick up your next tests. USALA requires all individuals, regardless of vaccination status, to wear a face mask in all indoor spaces on campus, including classrooms, teaching labs, libraries, pre-K through 12 facilities, and indoor recreation spaces, as well as when using Bruin Bus, Bruin Access, UCLA Safe Ride Services, and university vehicles. Face masks are also required in all indoor workspaces, including offices, except when one is alone in an office with the door closed. They may be removed prior to actively eating or drinking and must be worn again as soon as the individual is finished. Physical distancing is no longer required for fully vaccinated staff. Unvaccinated and partially vaccinated persons are required to wear face masks at all times and to physically distance at least 6 feet from others. 2021 emergency paid sick leave, also known as 2021 EPSL, remains available for use for specific COVID-19 reasons through September 30th, 2021. Full-time employees may take up to 80 hours of EPSL. Part-time employees may take up to the 2-week equivalent. The form is available through the link in your screen. Please submit the completed form to your supervisor prior to taking your leave. Effective July 1st, 2021, UC introduced a new leave option. The Pay for Family Care and Bonding, also known as PFCB, gives eligible employees the option to replace some of the income they would otherwise lose during their approved leave. To be eligible for PFCB, you must first be eligible for a qualifying family and medical leave under FMLA and/or the California Family Rights Act, also known as CFRA. Employees who qualify for PFCB can receive 20% of their eligible earnings for up to 8 weeks per calendar year. If you are in need of a leave to take care for a family member with a serious health condition or for baby bonding, please speak with your supervisor. More information can be found through the link on your screen. All employees are required to complete both of the COVID-19 compliance trainings, the COVID-19 prevention training and the COVID-19 prevention 2021 USALA update. The 2021 USALA update training must be completed before returning to work on site or by September 30th, whichever occurs first. All trainings are available through the Learning Management System, also known as LMS. If you are having difficulty accessing the system or training modules, please notify your supervisor. The temporary extension to vacation maximums for policy covered staff will expire on September 30th, 2021. Beginning October 1st, 2021, employees who remain over the allowed vacation maximum will no longer accumulate vacation hours over the maximum until their vacation hours are below the limit. All links to the sites referenced will be available on the intranet. And next up is the Q&A session.
Thanks, Veronica. So we will turn it over to Steve to moderate the Q&A.
Hello, everyone. Sorry, it's a little bit busy. We had some questions come in there at the end. but we will get to those in a little bit. What we're going to do first is we're going to run through the questions that were submitted via the link that was sent out beforehand. I'll read a question out and then I will pass it on to someone who's been assigned to answer. So I'm going to go ahead and get started. With partially remote schedules, are we looking into reduced price bus passes for commuters going 10 days or less per month? So for this one, I'll hand it off to Dave Karwoski from MPTS.
So good morning, everyone. When we set the fall quarter public transit pass prices, we did consider that some employees will ride the bus less than 5 days a week. For example, Long Beach, we dropped to $70 a month. But really the best advice I can give you is go to the webpage and do the arithmetic and figure out what works best for you. But we did lower prices to some degree.
Thanks, Dave. Next question. LAUSD has given the community a preview about COVID infections. Reports show that vaccinated people contract and transmit the virus. The more people congregate to share common space, the more chances the virus has to change and propagate, and the community suffers the consequences. That was the end of that submission. It's more a remark than a question, but we still like to give a response. For that one, I'm going to turn it over to Dave Wiedemann from CNPS.
Hi, everyone. Although this is, like Steve says, is not a direct question, it does deserve a response. So UCLA as a whole and Events and Transportation has put into place protocols, procedures, and equipment to support the return of its staff. And to name just a few of these, you just heard Veronica, but we're talking about honest completion of symptom monitoring on a daily basis when working on the UCLA campus, indoor mask requirement regardless of vaccination status, N95 masks will be available for all unvaccinated persons when requested, weekly mandatory COVID testing regardless of vaccination status. Air purifiers are in place throughout events and transportation workspaces. You just heard Gio talk about upgrading of HVAC filters. And anyone who is unvaccinated should be and must follow the 6-foot distancing guidelines that UCLA has put in place. And also everyone has access to the website covid-19.ucla.edu to review all of the protocols and procedures and more that are in place now to protect the campus community and events and transportation employees. Thanks, Steve.
All right, thanks, Dave. I'm actually going to take the next few myself, but before I do, I just wanted to remind everyone who's tuning in, feel free to use the Q&A function there. And I see some people have already started doing that. You can submit questions now. And when we're done going over these dozen or so pre-submitted questions, we'll tackle those. All right, so I'll move on now. Next question. Will unvaccinated people who file an exemption be allowed to work inside the office? The short answer to that is yes. Those who receive a vaccination exemption or are having their exemption processed may work in the office as long as they follow all the protocols required of employees who are not fully vaccinated. Next question. If I'm asked to do something for work that I'm uncomfortable with and or feel compromises my safety, can I say no? So this one's a little bit trickier. While everyone is still expected to perform the basic duties of their job, if you're asked to do something that you feel is unsafe, you should escalate the issue to your supervisor or to your local HR representative. Because what feels safe to one employee may not feel safe to another, this is going to be have to be handled on a case-by-case basis. Next question. What if people working at the office aren't keeping their masks on? Good question. So as you probably heard before, with the exceptions for eating or drinking or being in a private office, everyone is expected to wear a mask while indoors as of right now. If someone's forgotten to put their mask on, I say, please give them a friendly reminder. They may have just forgotten. We're still getting used to this for some of us. If someone refuses to wear their mask indoors, that's different. In that case, please contact your supervisor and a human resources representative so that the issue can be dealt with right away. Also, I believe on the office hours town hall, there was mention of a hotline that will be available later to report things like this. Next question, and this is a couple of questions combined, so I'm just going to read the whole thing and then turn it over. Can we request ergo home furniture for home office with hybrid schedule? Someone else asked, I heard about the furniture allowance. When will that be made available? Is that retroactive? So for this one, I'll turn it over to Clinton Bench from Fleet and Transit.
Thank you, Steve. And unfortunately, I'm having trouble with my camera, so you'll just have to look at my still photo from 6 years ago when I was looking much better than I am today. There is going to be the opportunity for staff who are working from home 3 days or more per week as part of an approved flex work plan on a long-term basis, for them to be able to order a ergonomic chair and also a height adjustable desk. Those two items are both ones that have been selected by insurance and risk management and purchasing. They will be available in a couple of different colors, I believe. And again, they will be centrally funded by the campus, so it's no expense to events and transportation. And finally, they will include delivery and setup. There will be a DocuSign form that's used to turn in the approved FlexWork agreement. And that will then trigger access for the employee to go to the website where they may order that chair and height adjustable desk. It is my expectation that Bruin Post will be going out within the next week with further instructions. I would also just say that there is some possibility for retroactive reimbursement for such furniture that may have been purchased by an employee in the past, but there is a process that one would have to go through to confirm that it meets the same standards as the furniture that's available on the website I described. That's it.
All right, thanks, Clinton. Next question, for employees seeking vaccine exemptions, what's the timeline for UCLA to tell them if it's approved? If an employee seeks an exemption and the exemption is not approved, what should departments do, either in the time period while the person is getting a vaccine, or if the person refuses to take the vaccine? So for that one, I'll hand it off to Veronica. Back to her again, Veronica from Central Admin.
The answer for that is Cedric is processing all exception requests for UCLA that were on hold early on. They were pending policy guidance from UC Office of the President's legal team. They just began processing requests about 2 weeks ago, and determinations should be coming out shortly. New requests are acknowledged within 24 hours by Sedgwick and includes forms that the employee must then submit. They have indicated that catching up on these early requests will be completed soon, and staying abreast of new requests in real time can be quite fast depending on how quickly the employee submits the required documentation. When an exception request is denied, there is a well-defined timeline in the UC policy SARS-CoV-2 COVID-19 vaccination program in the Appendix F, which begins on page 27 of the next steps. The employee has 14 days to submit proof of their first shots. And during the period until full vaccination, the employee can remain on site but must adhere to all of the requirements, including wearing their face masks at all times and staying 6 feet apart. If the person refuses to take the vaccine, they will then be provided with notice of their noncompliance and given opportunities to come into compliance. The policy on Appendix F, which starts on page 26, and there's a flow chart at the end of the policy for further details. Noncompliance eventually leads to the discipline process, which follows policies or collective bargaining agreements, and that response is provided in the town hall.
Great. Thank you, Veronica. I believe this next one's for you too. Let me read it off. A lot of people are still processing the psychological trauma of the past 16 months. Is anyone planning a campus-wide mental health approach to help managers lead within the context of the real fears and anxieties members of our staff are conveying to us?
This one was also responded to in the town hall, and their response was there are a wealth of resources and advice for students, faculty, and staff on maintaining mental health and well-being during the pandemic. There is also substantial information available on psychological counseling and other services and details on where to turn to in a crisis. Examples include the Semel Healthy Campus Initiative Center at UCLA, which has a COVID-19 well-being page, and Live Well podcast. Stand Together During COVID-19, part of UCLA's Depression Grand Challenge, also has tools, resources, and strategies designed to help members of the Bruin community boost their mood and ease COVID-19 related anxiety and depression. The Mindfulness Awareness Research Center and the UCLA Psychology Clinic are also great resources. Excuse me. More info is available at covid19.ucla.edu/emotional-social-and-physical-well-be.
All right, thanks, Veronica. Next question, good simple one, but a good question. Can I eat at my desk? Short answer to that one is yes. Although if you're not fully vaccinated and you have to take off your mask to eat, you must stay 6 feet away from others. Next question, I believe this was the last pre-submitted question. Why are our cubicles getting replaced with hotel spacing, or as I think we now call it, the flex workspace, something other departments on campus are not doing, when we may eventually return to the office full time at some point in the future? So for this one, I'll go back to Dave Wiedemann.
Hi, everybody. Again, just as a reminder, the plan to create more open, inclusive, and collaborative and flexible workspace has been in place actually for several years. The fact is the pandemic has created an opportunity to move forward with these plans without much interruption to our people. Not sure how other offices or departments are configuring their departments or approaching their workspace, but Events and Transportation decided pre-pandemic to make these changes, and we are now moving forward and believe it is the right approach to working collaboratively. Also, speaking to kind of the full-time return portion of this question, E&T is supporting flex work, which reduces density of in-person staffing for the long term. Thanks, Steve.
All right, thanks, Dave. So that does it for the questions that were submitted by staff before today's meeting. What I'm going to do is, looks like there's a number of questions that have been asked during the session today, and it looks like they're still rolling in. What I'm going to do is I'm quickly going to go through the ones that have already been answered, although I believe everyone can see those if you click on the Q&A button at the bottom of your Zoom window. And then we'll go on to the having the panelists answer the open questions. So first answered question. Now that the CDC has officially confirmed that both vaccinated and unvaccinated people can both acquire and transmit COVID with the same viral loads, why are we treating the two groups differently? Answer was unvaccinated individuals are more likely to become infected and thus transmit the virus to others. Further, we are following the advice of our infection control specialists and protocols issued by LA County DPH, so Department of Public Health. What can you tell us about having telephone sets available on our desks? With the move to soft phones for many units in E&T, we have/are ordering headsets for use for our staff. So, hope that helps. There's a question for Tyler. Are we the MFA? Team was having issues accessing shared documents in SharePoint and getting an error. Could this be because some members have already moved to MFA while some have not? Is this normal? Tyler had answered, this is most likely related to the MFA migration. His team's found that anyone using OneDrive to manage documents and share with others had this issue. The URL was changed as part of this project, and Tyler's group will work with you and your team so that you can use updated links. Looks like there was a question accidentally submitted as a response to Tyler's question. I guess we can go ahead and tackle it now so we don't forget. Why are not N95 masks not being offered to all employees who want them? So if you'll recall, I believe it was stated that they will be made available to unvaccinated staff who request them. Largely, it's a supply issue. If there is no supply issue, I actually think our management team is in favor of giving the masks to anyone who requests them. But during many times during the pandemic, these sorts of protective masks were hard to come by. So that is the guidance that's been given us. We've been directed to offer them to unvaccinated employees who ask for one. On days,
Steve, can I just jump into just to provide a little additional background? You're exactly right, but just to go a little bit deeper, that what was read is exactly the guidelines coming from public health authorities. So I would just reinforce that was sort of the base level, and what you said is a good add-on for events and transportation. Thank you.
Great, thanks for clarifying. Someone asked, on days when we're scheduled to work from home, are we free to come into the office and use the hoteling, the flex workspace whenever we feel like it, or do we need to stay home? The answer was, as long as you're cleared to work on campus via the symptom monitoring survey, you can come into the office on days that you are scheduled to work from home. Question, there are other departments that are extending their return to work to January 2022, such as some units with campus administration, or I guess in campus administration. Has this been taken into consideration for E&T's return to campus? And the answer was, yes, that's correct. There are some departments that are extending their return to work date to January. E&T has decided to implement our return to work plans in early September. We're a department that provides substantial on-site support to students, faculty, visitors, and other staff. And UCLA is returning to in-person classes for fall term. Furthermore, on-campus housing will be operating at full capacity. So in short, as to support our customers, we are keeping with the current plan to return after Labor Day. Is there any update from campus on furniture for remote work from home? This was already answered in the pre-submitted questions. We covered the N95 masks. Does flex work include working 100% remotely? Answer was working 100% remotely is a type of flex work, but not the only type. So basically at that point, someone is a telecommuting employee. And so they could have a telecommuting agreement, but it's not a hybrid schedule. So with that, unless anyone on the panel wants to chime in on something that I already discussed, I'll move on to the open questions. Did someone just answer another one? I saw it change from number of answered questions from 9 to 10.
Yeah, we might need to scroll through because it looks like more got answered and it like changes the order.
Yeah, I went through.
Yes, I just answered the workers' compensation question, Steve.
Oh, I see. Will UCLA cover any vaccine-related injuries? Will they fall under workers' comp? Answer, workers' comp covers injuries that occur during the course of performing job duties as determined by Sedgwick. So Sedgwick is the name of the company that Veronica had mentioned early in her portion of the presentation that was processing the exemptions based on for medical reasons. Okay, now I'll move on to the open questions. I'll just start from what I see at the top. If I live with someone who is immunocompromised and I'm concerned about returning to work in the office, should I file for FEMLA? Is there an exception to work fully remote? This one, Veronica, I don't know if you have thoughts on this one. I guess we'll start with the first question in there is FEMLA appropriate?
Can I just, can I jump in real quick and then hand it off to Veronica?
Yes, please.
As folks know, I've been dealing with a lot of COVID response and recovery issues on a campus-wide basis, so that's why I'm jumping in. Veronica certainly knows a lot more about human resources than I do, so I'm not trying to not trying to suggest that I know more about that than her. But I would just note that there are we're getting a lot of questions campus-wide that are really case specific and individual specific and sort of situation specific, family specific. And a lot of these kinds of questions, I hope that folks aren't feeling like they're being ignored, but rather in many cases, it's really a case-by-case question, and case-by-case issues should be brought to, you know, human resources and insurance and risk management, just like case-by-case issues about COVID should be brought, you know, forward, just like case-by-case issues would in a non-pandemic time. So I just wanted to give that general response and now kind of hand it back over to Veronica for any more specific things. I'm not sure she can, it's kind of like, you know, calling Dr. Radio on Sirius XM. I don't know if anybody else that listens to that, but you ask a very specific question and you say, well, without examining you, I can't answer. Anyway, go ahead, Veronica.
Family medical leave is leave to care for a family member with a serious health condition, or if you yourself need to take a leave. So as Clinton stated, it's on a case-by-case basis, and it would be something that would need to be recommended medically. So, you know, you can go ahead and have a consultation with a leave consultant from the HRPOC, and, you know, complete the documents, and it's up to them to determine if that's something that would be covered by FEMLA.
Yeah. And then the follow-up question was, is there an exception to work fully remote? So I take it what they're asking is, are there exceptions that are in place for someone in that situation that would allow them to work fully remote, even if other people in the same position are not doing so? As far as I know, there's nothing in place, but again, as both Clinton and Veronica had mentioned, this could be handled on a case-by-case basis. We would most certainly work with HRPOC and campus HR to figure out if accommodations are appropriate or necessary. Right. All right. I do notice that some questions are getting answered by panelists who are typing in answers, and they're going in. So I will try to find those later. For now, I'm going to quickly continue to run through the open questions. Why are some E&T operations allowed to work remotely 100% and others not? Frontline staff is, I'm not quite sure what that word is.
I'm going to say understandable.
Understandable.
Frontline staff is understandable. Admin staff, not so much. Does anyone want to take this one?
Yeah, I'll take it.
Okay.
So, you know, the flex work is the goal. We want to be as flexible as possible. But as we each have a business unit to run, the approach is going to be a blend of what the employee wants, what the manager thinks is necessary to complete their unit's work, and what works best for the department. So, you know, going back to what Clinton said, it's going to depend upon what your function is. For example, a bus operator. they need to be on campus. There are various viewpoints, and there may be some disagreements between a staff member and the manager, but that's what we're going for, is a blend. We have to get our work done and complete our mission, but at the same time, we'd like a happy, engaged staff, and part of that is trying to meet them in the middle, so to speak. Back to you, Steve.
All right, thanks. I don't know if anyone else on the panel had anything to add on that topic. Otherwise, I'll move on. Question, regarding psychological services on campus for individuals, can we also schedule a psychologist for therapy in group sessions? Okay, I know that, you know, staff and faculty counseling is available for that. So if anyone is interested in group sessions with them, they're a great group, you know, headed by Jorge. They are available for group meetings and to discuss, you know, health and wellness. Beyond that, I don't know if anyone on the panelists is aware of resources that are available. I'll open it up here.
I think, Steve, what I would say is that if that is something that interests people, talk to your manager and we will make sure we get it arranged as early as possible in September.
Okay, great. Question, how do we report someone not following COVID guidelines? Are we allowed to refuse to be in close proximity to someone that is not following guidelines, including not being in meetings with that individual? Clinton, I believe you'd like to answer this one, yes?
And I think there were a couple of questions that were sort of along these lines. I think I would state a couple of things. One is that there are policies that have been put in place to keep our community safer and reduce the risk of COVID transmission. And those policies right now include wearing a mask indoors. And there is also the campus-wide policy to get vaccinated. And those are two of the most important factors in reducing risk of COVID spread on our campus. So what I would note is that a policy is a policy, and if someone is violating a policy, the violations of those policies would be addressed accordingly. And if someone feels that someone else is violating that policy, those concerns certainly can be raised to a supervisor or a manager. There's no question about that. That would be the case for any observations of policy violations. And there are also a number of other resources available on campus where if a person didn't feel comfortable raising something to their supervisor or manager, that they could raise it. I would say that even though September is coming very soon, the pandemic throws us curveballs all the time. So not every procedure and protocol has been completed. And I know there are more clear guidelines being developed as we speak. So I can say that there will be more clarity to share soon. But right now, I think what I stated is probably the the information that's best available right now.
All right, thank you, Clinton. Here's another question. How should supervisors handle employees that claim discrimination based on their vaccinated status? So, Veronica, do you want to take that one, or?
Sure.
Right.
If anyone feels that they're being discriminated against, then definitely please talk to your supervisor about it. And also you can talk to your HR rep. that you can go ahead and advise and look into the situation.
Right. So similarly, if a supervisor has an employee that's claiming discrimination, the supervisor can come straight to the HR representative. So
Yes, absolutely.
Or myself, or if it's faster for you to contact a departmental administrator or rep who isn't already Veronica, you can feel free to do that as well, and they can direct and triage to us. Right. I'll mark that one as done. Okay. I think there's one open question here that's left. I have a child that cannot receive the vaccine. Returning to work in the office puts my child at risk due to my increased risk of exposure, since vaccinated people can still transmit the virus. Is there any consideration to allow staff to continue to work 100% remote to alleviate their concerns? I think this is similar to the question about someone who lives with an immunocompromised individual, and that it would have to be handled on a case-by-case basis. That there is no written policy in place though that gives exceptions right now to parents of children who are too young to be vaccinated. I can say that, but we would handle this on a case-by-case basis. So you bring it up with your supervisor or come to your local HR representative. Did anyone else on the panel have anything to ask on that one? All right.
Yes, Steve.
Yeah, go ahead.
There's also the 2021 EPSL, the emergency paid leave. If they have not already utilized that, they could utilize that. It doesn't have to be used in an entire block. It can be used per day or per hour, actually. And it's only available through September 30th. And we're not sure if that's going to be extended yet or not. If it is, we'll definitely let everyone know.
Okay, so that was, in this case, it would be EPSL used for, the reasoning is they have a child that's too young to be vaccinated?
That could be the case, yes. Or someone that they need to care for, if it's an older child.
But if their school is open, is that still the case?
Well, it would be on a case by case. So we'd have to definitely see, if their child is actually attending school, they may be at home, depending on what their situation is.
Right. Okay. All right. Great.
A little more detail but that's, personal issues that we could go ahead and address with that particular employee. They can reach out to their supervisor. They can reach out to me, and we can go ahead and see what would best work for their situation and what they may be eligible for.
Got it. Thank you. Oh, another furniture question that I think Clinton's volunteered for. For employees on flex work, is it possible to reimburse the cost of ergonomic furniture, since we all have been working from home for over a year at least? Some of us already bought furniture. Clinton, is there an answer for this one?
I know we're right at the end, so I'm just going to reinforce what I said before, but also clarify. If you have already bought it and moving forward, you are working 3 or more days per week at home in accordance with an approved flex work plan, then you can ask for your previous purchases to be considered for reimbursement, but it is not guaranteed, as they need to meet the same ergonomic standards that the new furniture being offered does. And the limit would still be $1,400, I believe, but that is also not guaranteed.
Okay, so to clarify, they would still have to be an employee that's going to be working from home 3 days a week or more, going forward, like in the future, in the fall and beyond. Okay, got it. So basically, you would have to be eligible like everyone else right now. Okay.
And you can't do both. You can't get reimbursed for the stuff you got and get a new desk and chair.
Okay, so it's past 11. What I'm going to recommend is that we take all the answers that have already been answered and typed out, since some of them weren't verbalized. I think everyone can see them in the Q&A, but we'll have our team, Lauren, can those be captured and then collated in one place for distribution later?
I will see what we can do. I just did a test to copy and paste and it did not work. So we'll hang on after people leave and see what we can do to export those.
Right.
Lauren, can we also continue to use the question sheet that you already set up if people have questions going forward, and we will answer them and distribute and make the answers available for public consumption?
Yes, so that form is still live. So if people have additional questions, you can still click on that link that was sent out in the E&T news bulletin. And then, yeah, what we'll do is when we send out the follow-up email with the PowerPoint and the video recording of this session, we will also include the Q&A information.
Great. And then last but not least, there is a lot of information on the UCLA COVID website. So that's also a really good place to get some very specific answers to questions. I went there myself yesterday.
Yeah, and Clinton just sent the link for that to on the chat, but it's very easy to find. Okay. All right. If
Thank you
there's
all.
nothing else, panel, thank you very much. Thank you, Lisa. Thank you, Lauren.
Thanks, everyone.